Hi, Assalamualaikum. We present our group assignment about hazard identification risk analysis review for Dr. Abdul bin Rahmat. We from NBSA 6A. This is our group member. First, Muhammad Syazwani bin ISMAIL, DAMIA EMIR binti Muhammad ARRIF EMIR, NOOR HASIDAH binti AHMAD, Adriana Syazwani, AIENA binti ABDUL SHUKOR, and NAISA binti ARALI. In this assignment, we have 7 parts to discuss, which is the first one is profile of competent person, company background, industry experience, hazard identification, relevant question about the course, how the interview impact understanding of OSH, and the last one is conclusion.
Assalamualaikum. Today for our assignment, we have interviewed a computer person who practicing safety and health practitioner in Kementerian Kesihatan Malaysia. We interviewed an employee was named Puan Siti Mariani binti Mak Yasin. He working as a health inspector officer since 2009, and in 2010 she was in charge in unit safety and environmental health, and make more program to make sure that our staff in Kementerian Kesihatan was safe in safety occupational.
Okay, for company background, the Putrajaya Health Office is one of the health institutions that administer the health sector for the district of Putrajaya under the Federal Territory of Kuala Lumpur Health Department. So the Putrajaya Health Office was first established on 1st January 2001, which consists of 5 sectors, namely public health management sector, nutrition sector, health promotion sector. The Putrajaya Dental Health Office has an indirect relationship with the Putrajaya Health Office in improving the delivery of health services in public. So the Putrajaya Health Office collaborates with the health unit Putrajaya Corporation in implementing the following health and monitoring activities. So the first one is provide family health services. The second one is provide public health activities. This is control and health educations. The third one is provide health promotion and health law enforcement, and the last one is provide public health management. So to provide health services to the people of Putrajaya, a total of 4 health clinics and 1 health screening center are currently operating. So the first one is Putrajaya Prison 9 Health Clinic. The second one Putrajaya Prison 11. The third one is Putrajaya Prison 14. The fourth one is Putrajaya Prison 18. And the last one is Civil Servants Health Screening Center. Okay, so experience in industry in the health sector today faces various challenges and factors to create a clean and safe work environment. So in general, all health workers can work together to control workplace risks and meet regulatory specifications. So all officers, customers, and the general public are key components involved in the affairs of the key framework for the function of obtaining health services as well as other key matters. The health officer is the person responsible for ensuring that all 3 of the following elements, namely health personnel, customers, and the public comply with the standards to create a safe environment during the process of services being provided or provided. Okay, health workers who work in health facilities are also exposed to various elements that can provide risk in carrying out daily tasks. These health workers are very vulnerable to the cause of infections and also sharp and dangerous tools which can pose a risk to safety and injury. So as an employer, the district health officer is also responsible for ensuring that the day-to-day affair treating patients are carried out in a manner that ensure the welfare and health of its employees and all individuals, including the general public. It is safer and healthier to work in an environment when employees are counsel and participate in decisions or on safety and health. Okay, so consultation on safety and health is a two-way street. It requires informing employees, listening to them, and considering what they have to say before the boss make a decision. So maintain a session, for example, at the beginning of the job to review the day's work, determine risk and agree on effective control measures. Therefore, Puan Sri Mariani binti Mak Yassin is the officer in charge of the safety and health unit at the Petroleum Health Office to manage all program activities related to occupational health. Thank you.
Next is hazard identifications. In hazard identification, we have 5, which is the first one is ergonomics in the workplace. Okay, which can cause or effect? We have 3. The first is lower back pain, second shoulder pain, and third is vein sore. The risk analysis and risk control. This hazard likelihood has a good chance of occurring and is not unusual, and the severity is minor abrasions, bruises, cuts, first aid type injury, while the risk control that the officer takes is providing safety glove for the use to each employees that handle the equipment. Okay, now we look into relevant question about the cause. The first one is, what questions should I ask about health and safety? Second, why it is important to be aware of the safety and health procedure. And then, what is safety and why it is important? Why you need it for your workplace and business? What are the common safety issues that you should be aware of? Why do we need to know the safety precautions in every facilities? How can you promote healthy and safety practices in the workplace? And the last one is why it is important to practice safety procedure and proper handling of tools and equipment in the workplace.
The effect of human exposure to chemicals and other harmful substances can range from simple skin irritation to long-term illness such as cancer. Recognizing the danger that exists, it is important to establish a safety culture for handling, transporting, and storing such materials. All employees responsible for handling hazardous materials are required by federal regulation to undergo proper hazmat training. But that does not eliminate your company's responsibility to provide an environment conducive to the safe handling of hazmat materials. Encourage your employee to take ownership to create and maintain a safe work environment. Start by following these 10 rules that represent the best way to avoid hazmat occurrences. Assess the risks that exist in the workplace. Know the materials in the workplace that represent hazard. The second one, provide employees with adequate training and information about hazardous materials in your workplace. Thirdly, consider potential dangers and plan ahead. Always use correct personal protective equipment (PPE). Old or damaged PPE should be replaced, and PPE should be inspected before each use. 5. Make sure all hazardous materials are properly marked. Make sure all hazmat containers are adequately labeled and all chemicals are stored in appropriate containers. 6. Keep all hazardous material properly stored. Store chemical in a dry, cool and ventilated area and isolate incompatible materials. 7. Only use hazardous materials for their intended purpose. 8. Always wash your hand after using, handling or transporting hazardous chemical. Never eat or drink while handling hazardous materials. 9. Employees who handle hazardous material should always read labels to understand what they are using. Last but not least, report any concern about damaged containers or possible leaks or spills. You can trip or fall when you catch your foot on anything or lose your balance. Some of the typical causes of slips, trips and falls include spills, ice, snow, rain, loose mats, rugs and step ladders. Additionally, injuries like sprains, strains, bruises, burns, fractures, scratches and cuts can result from backlighting and clutter. Any workplace is susceptible to trips, slips and falls. Thus, they should not be disregarded. They may lead to sprains and strains are considered minor injuries, broken bones from the force of attempting to stop the fall, back injuries brought on by the falls, cuts if the incident takes place close to sharp items, injury to the head if the subject hits their head on impact, burns if the person is handling hot liquid or the occurrence takes place close to hot surface, and lastly, death is more severe situation. For instance, if a building is not barricaded, a person may trip and fall from the exposed side.
Assalamualaikum, my name is NOOR AHMAD. So today I will talk about ventilation in enclosed areas. So first is the hazard, ergonomic hazard, which can cause or effect for respiratory irritants, extreme cold, and also asthma. So for risk analysis and risk control, this hazard likelihood has not been known to occur after many years, and the severity is minor, while the risk cost that the officer take is enhancing a safe work practice employees. Okay, so overloading electrical socket hazard, physical hazard, so which can cause effect for burning injuries, cuts and bleeds, and electric shocks. So relevant question about the course. What question should I ask about healthy and safety? What it is important to be aware of the safety and health procedure? What is safety and why it is important? Why you need it for your workplace or business? What are the common safety issues that you should be aware of? Why do we need to know the safety precaution in every facilities? How can you promote healthy and safety practice in the workplace? And why it is important to practice safety procedure and proper handling of tools and equipment in the workplace.
Hi, I will explain about how the interview impact understanding of RSH. So, in this interview, we learn more about the economic in the workplace. Because some company does not follow the economic rules, which is dangerous, because economic will involve a long-term personal help to their staff.
And the second one is we learn that the dangers of chemicals to all workers and dangerous equipment that can cause injury to all workers. So, to involve with the dangerous equipment, which is chemical, only the trainer can do this because the chemical is really dangerous. So people who can handle this is the employee that already trained by the certain people. The third one is exposure and guidance by officer to operate the equipment and system used for indoor air quality monitoring. The fourth is positioning wiring and boxes in a proper place to avoid unfortunate accident and injuries. The wiring and boxes sometimes can make employee and other staff trip or slip and fall, so it will become dangerous to staff because it can injure their leg or head if they fall, slip. The last one is avoid overloading electrical socket to prevent from any socket explosion and endanger employees' safety. So the last one means do not, the extension, don't plug overload, because when it's explode, it's really dangerous to all the employees at the company. That's all what we learned from based on the interview that we have do it. Thank you.
So for the conclusion, we know that the challenges and experience working as safety and healthy officer. On top of that, we know how Puan Siti Marani binti Mat Yasin handles all the issue that happens in the company. Also, we also know how she began to learn about ISO from ISO quality 9001 to ISO safety and healthy 45001 to ISO environment 14001. These three ISO must be completed to become a safety and health officer. Thank you.